Welcome back. A healthy gut can be crucial to your mental health in the coming winter months. It really can all year long, but especially now. Dr. Frank Dockler is joining us from Broadview Health Center. I thank you for being here.
Well, it's good to be here again.
I am on the gut health train. I hope we can get others to be on board, because when you really start to understand how much our gut influences everything else in our life, from physical symptoms to mental symptoms. I mean, it's crazy what it's in control of.
You know, you're 100% right. And when we assess a patient in the office, whether it be for diabetes or neuropathy care or injuries where we're utilizing more chiropractic and rehabilitation, we always have to take a look at the gut, because that's how much it influences all aspects of our health. The healing process, the feel-good process, just about everything.
So when you have a bad gut, or you have leaky gut, or whatever, there's different terms they use, or just it's all awry, what does that necessarily mean? So
what you can actually form these little perforations within the gut itself, where blood and different nutrients will extract from there and not absorb properly. So a lot of people don't understand the concept of serotonin. It's a neurotransmitter, and it's the most common one in our bodies. Some people call it the feel-good chemical. And so when serotonin levels are up and healthy, our mood is good. We're sleeping better. Again, it's called the happy chemical. But what happens is 95% of that is produced by the lining of the gut.
See?
And so when you upset those good bacteria in your stomach, they produce a toxin, an endotoxin. And then that starts to cause those other problems that you're referring to, the leaky gut, et cetera. And when that drops, that's where you'll see in cases anxiety, depression, gastrointestinal issues, IBS, just to name a few, hypertension, can all be due to what we're putting into our bodies and not taking care of the little gut microbiome.
And those are symptoms, so to speak, that we feel, but we don't realize the root cause of them.
And I'm not saying every single anxiety case is due to the gut microbiome by any chance, but a good percentage of them are, and instead we're given these medications to treat that, instead of just going ahead and trying to correct the gut first.
So how do we do this ourselves?
So the first thing we want to do is want to minimize the things that can cause it. And it's nothing surprising, I think, to most people. Alcohol, high sugar foods, processed foods, all those things will upset that gut microbiome. But if we can eliminate those, drink a little bit more water, you can actually rehabilitate that microbiome over a period of just a couple weeks, to be honest with you.
So it's not that you've damaged it for life. You can rehabilitate it. You can fix this.
Exactly. There's different foods that are both prebiotic and probiotic. Prebiotic just means that you're laying the groundwork, kind of like enriching the soil for those good bacteria to grow.
And fiber is a good way to do that, right?
Fiber is one of the best ways to do that. You're going to find that in your green vegetables primarily. Fruits like apples and bananas also help with digestion and the increase of that gut bacteria. Things like a good yogurt, kimchi, any fermented foods, sauerkraut, one of my favorites for doing that.
Fermented foods are crucial, right?
They absolutely are. And we're one of the few cultures that don't have that as a staple within our diet. Things like that, apple cider vinegar. If you're going to have bread, sourdough bread, because of the lactobacillus as opposed to the yeast that help for the rising of it, are all good in recreating that gut microbiome.
Do you have supplements there too? Are there supplements that would be helpful?
Yeah, so there are some supplements. Some people will still refuse. You know, if I say, well, do you like sauerkraut? And like, no, I don't like fermented foods. I don't like sauerkraut. And they ask about a probiotic. There are some good probiotics, but you do have to be careful, because not every probiotic is going to work within our gut. So some will try one, but it's not the right combination. And they say, well, I tried that, didn't work.
Gotcha.
So those are, in my opinion, supplements are a backup to that. We start with these foods first, exactly.
Now, you have cheese there, too. I love when cheese can be added into the mix, huh?
Well, very few. So hard cheddars, mozzarella, cottage cheese, but not all cheese. And go ahead.
No, I was just, I'm hearing you talking about all this. I know these are things we can do when we're at home. How then do we transition to in using your help in the office, and how can our office visits really add to this?
So sometimes it does take a little bit more. Sometimes it's the coaching aspect and a little more structured program. So whether they're coming in because they injured their back and we're also working with that inflammatory response, or if they're trying to control the diabetes or weight loss. We'll come in, we'll do a full evaluation. We take a thorough history. I learn what they're putting into their bodies on day one. And we can start to make those small corrections. Not everybody can just take and say, okay, well, I'll just do this now. It's little by little.
And it's a process, right? You can't just eat too much of fiber if you're not used to fiber. You'll start feeling probably
It can
not
block
so
you
bad,
up. Yeah,
not so
yeah.
good.
Too much
and then
fiber
you
can
give
be
up on
bad.
it, which is not a good thing too. So
Exactly. So sometimes just that little instruction, we change some habits, and over a period of a couple of weeks to a couple of months, we can really change someone's life.
well, you're doing it today. I thank you so much
Thank
for
you.
being here. Gut health, folks. Just remember that. You got to get on top of it. Thank you for being here, Doctor.